This is Eezy 107.5 FM.
Akosua is sending us a message from Cantonment. Says, Dr. Dickson, how should emergency contraceptives work? How do they work? And how soon should they be taken? I'm sorry I didn't mention that, Akosua, but emergency contraception is only for emergencies, okay? So I really try to discourage using it on a long-term basis. It works by preventing the implantation of the fertilized ovum. It makes the lining of the endometrium very hostile. It decreases the glands for the nourishment of the ovum, and also it makes the environment hostile for the fertilized ovum to implant. So it has to be used relatively short time. As soon as you realize, like 24 hours, maximum 48 hours after that, it may not be as effective. And it's just very simple to use. It's either just 2 tablets taken 12 hours apart, and it's actually a pack that you just pick up and follow the instructions, very easy to use. Or if you consult your doctor, sometimes we can put an IUD in place immediately, and that can also take care of the avoiding pregnancy. There's another question from Amma from La Paz. It says, I heard you say the IUD had some negative publicity. Please, what was it? That's what I'm using now. Oh yes, probably even it came before you even had yours inserted. Back in the 60s to 80s, the type of IUD that was on the market was different. There was one called Lippes Loop, for example, LIPPE. And the string that was attached to the Lippes Loop was a woven material like cloth. And because of that, bacteria could climb in between it and around it and get inside the uterus and cause very serious infections. And because the IUD back then had become so popular because of the ease of use, doctors were just willy-nilly putting them in very young women who were out there having a lot of sex. And because of that, some young women, unfortunately, had very serious infections needing hysterectomies and all that. So there was a backlash, and the IUD was banned in some places. The IUD has been reinvented. Now it uses what we call a monofilament. That is it does not allow bacteria to climb up as easily. And also now it has hormonal benefits as well. So, and the last thing I heard actually also is that the IUD, for some reason, maybe just a string being there, irritating the cervix, causing it to shed frequently, also decreases your risk for cervical cancer as well. That's very important. So I'm glad you sent us this important question to elaborate a little bit on the IUD use.
This is Eezy 107.5 FM.